Thank you very much. Hello. My name is Jay Parkinson. I grew up outside St. Louis, about 40 miles outside. All of my schools when I was growing up were in the middle of cornfields, right? And I liked golf, and I liked clothes, and the kids that I grew up with didn't like that. And, they also thought it was weird that I had a permed mullet. I don't know if you guys saw that. They didn't like me so much. But anyway, it sort of taught me that, I didn't really need to care what other people thought of me to be who I am. So I graduated. I went to medical school. The medical students were a little more tolerant of my quirks. And then, I went to do a pediatric residency and started taking care of little kids like this. This is my goddaughter. And then came down here to DC, actually, and my second residency, I did one in preventive medicine and worked with the public citizen at Ralph Nader, and I realized that they're the only watchdog group on the pharmaceutical industry. There's only 8 people that work there, and half of all Americans took a prescription drug last month. So there's only 8 people making sure that we're pretty safe outside of the FDA. So I thought that was pretty interesting. And then I went to work at Hopkins with this gentleman, Peter Provenost, who was a great guy because he created this thing called the surgical safety checklist. And that saves a ton of lives because it makes sure that surgeons don't chop off the wrong leg. So I just sort of learned that everything's a process, everything is an experience, and you really have to design both. And it was about the same time that I started reading this gentleman, Eugene Debs. He's the only person in America to run for president of the United States from a jail cell and get more than 5% of the vote. But he said, when great changes occur in history, when great principles are involved, as a rule, the majority are wrong. And I think that's absolutely true. So in healthcare, is the majority wrong? Well, that's my question. I think it kind of is, because institutions will try to preserve the problem to which they are the solution. And I didn't want to be a part of that institution at all. So what I did was I moved back to New York City, and I wanted to start my own practice. I wanted to do something totally different, because I really do love New York. And this is what my practice was. This is my website. I designed it. I saved up $1,500 during my residency to start it. And basically what it was, you go to my site, you see my Google Calendar, you choose a time and tell me your symptoms and your address. My iPhone would alert me. I would do a house call. You'd pay me via PayPal, and you'd follow up via email, IM, or video chat. Now, that was amazing. That was September of '07, right? So it was a while ago. But my overhead was about 10%. A regular doctor's office is about 70%. So it enabled me to be profitable almost immediately. So I could do my own thing and be happy. So I got about 7 million hits on my website in the first month. I couldn't see all of them, unfortunately. It led to a lot of press. I mean, it's sort of a good story, like a young doctor making house calls using the internet in New York City. It was fun. But that led to a lot of press, and then it led to me starting a company called Hello Health. And Hello Health is basically an online platform that allows doctors and patients to create profiles and interact with each other in person and online. So if you can imagine a patient has a profile, it looks like this. They can find the doctor and schedule an appointment with them. And then we can, after we've seen you in person, because this is all about augmenting the in-person relationship, we could follow up via, chat or video as well, and that's what this looks like. Well, of course, we had to build the back end for doctors as well, and so this is what that is. And it's kind of cool because it's sort of like the God view of your practice. Imagine what Facebook's news feed looks like and apply it to healthcare. I don't think this is really genius. I just sort of stole things from what Facebook and Flickr was doing and said, how could this help me as a doctor? So this is a patient's profile, and it's really cool. Down in the bottom right, you can see that I could add my patients to groups. So for example, all of my asthmatics, I can put them in the asthma group. And whenever I see something awesome on the internet that I want every one of my asthmatics to read, I just send the whole group a link, because it's sort of called like information therapy or something. This is doctors. It's a social network for doctors because doctors are now connected by brick and mortar, and this is now enables doctors to be connected via social network. So I can talk to a doctor in California about this dermatological condition because I know that he's the best. We had to prove out the concept, and this is the first practice in Williamsburg. It was an old vintage clothing store before we got a hold of it, and turned it into something that I thought people would want to go to. We had to advertise it, and I thought this really, simplifies what we're trying to do in New York. So the point is this: all of this was designed to function as one seamless, great experience for people. And then one day, I got this letter from the state, and they were like, the issue we're investigating you for is you're using the internet to practice medicine. Not only that, they were like, and we're also investigating your photography. And I was like, what the hell? I picked up photography as a resident, actually, started taking pictures on my time off in New York City. I only got, 3 or 4 days off a month, and it just was my creative outlet. And these last pictures are pictures that the NHS, the National Health Service in London, recently hired me to take. I presented all of my records, and then they just said, well, $8,000 for legal fees, 2 missed days of work. I then got another letter saying, we're sorry for the inconvenience. And I was like, oh, thanks, me too. I really did learn my lesson, though, and it was kind of weird because I always thought of myself as an outsider, but I didn't realize that the medical culture is not only uncreative, it's anti-creative. And I think there's a few reasons for that, but most importantly, why should doctors be creative? Well, it's interesting whenever you think about the concept of health, right? We've seen Roseanne a couple times, maybe. I think they're actually really interesting because although they're not the skinniest people around, they actually really loved each other and got through life together as a couple. And to me, that's health, And whenever you look at somebody like this, who's very much the epitome of health, right? I don't know if I'd call that guy healthy, especially where he is now. But it's sort of interesting because doctors need to think about health in a different way. Because right now we're suffering from this chronic computerosis, we have like armchairitis, and we have this thing called descarria. And that's a real issue right there. But in reality, we're sort of like, we're sort of almost anti-exercise in our culture, right? Of course, we're eating food from places like this, and it's not real food, I don't think. But in reality, it's interesting. If you look at life expectancy from 1880 to 1960, we added 31 years to our life expectancy, which is absolutely amazing. I mean, we have to give doctors and public health people serious props because that's a serious accomplishment. But that was accomplished with clean water, vaccines, and antibiotics. So now let's think about the age of modern medicine. So let's look at 1960 to 2010. We've added 7 years to our life expectancy. That's the era of Lipitor and stents and diabetes medications. We solved about 80% of the problems with very stupid, simple things. And now we're stuck with very difficult problems. And life expectancy is essentially flatlining. But it's interesting because whenever you think about the fact that about 80% of your entire lifetime healthcare costs happen in the last 6 months of your life, we realized as doctors that there wasn't a lot of money in a death that looked like this. And now all of a sudden it looks like this, and look at how much cash we can make off that. And that's a really sad thing to me. But, doctors only have pills and we have scalpels, right? And those are the only tools that you get as a doctor. And I think that's limiting our options in a serious way. So where is the value for that $2.5 trillion that we spend on healthcare every year? Well, I do think there's a creative way out of this, but I'm afraid that doctors aren't going to lead us out of this. Our reality is very different from an innovative, creative culture. On the first day of medical school, we surely do fall into line. We realize there's a hierarchy, there's an attending, a resident, and a medical student, and you don't question that because when you do question that, they sort of look at you differently. and they don't really like different. And I got many of these looks in medical school. It was kind of fun for me, though. But and also whenever we take our tests, we study these like algorithms, and even whenever we treat our patients, we treat them with algorithms. We regurgitate. We don't think creatively. And then we also have this thing called a God complex. And we're sort of trained to think we're a little bit godlike, I mean, who wants to go to a doctor that thinks they're wrong, right? So it's ingrained within us to be right, and to think we're right, and to be confident from day one. And whenever you're creative and innovative, you have to think that you have to be comfortable with being wrong. And it's very difficult for a doctor to be comfortable with that. Whenever I graduated from medical school, I was $280,000 in debt. Debt is one of the most pacifying forces of a culture. And whenever you're in debt like that, you just take the cush job. I'm currently $204,823 in debt. I pay $844 a month. To eliminate that, I'll pay that off when I'm 65. This is what our 20s looks like. We work over and over and over and over. We get a couple days off a month, and we're just so friggin' tired, right? It's just time to settle down. I mean, whenever we're done, we're about 30 years old. It's about time to have a family, start kids, and then, we sort of feel like we deserve this life of luxury because we've been working so hard. We sacrificed our 20s. So doctors are giving up private practices now and becoming more, they're starting to get employment from large institutions. And so whenever we get hired by a place like this, we're just become a cog in the machine. We're not very agile. What we need is something that looks a little like this. This is my first practice. That's my dog. My place looks a lot nicer now. But, I mean, I was very poor at the time. And whenever we are coders and medical students have some interest in doing things differently, it's difficult to find attendings who are willing to help us. So we're also terrified of the law. This is one of my favorite things on the internet. It's Dr. Cranquis' mumbled gripes. And he's a guy using Tumblr's Ask and Answer question feature. And he's answering really great questions from the Tumblr community in a really funny, entertaining way that's actually clinically very smart. And so he's helping random people on the internet. But look at his name isn't really Dr. Cranquis. He's anonymous, but he's providing really amazing content. He's terrified of the law. And every time we hear this word malpractice, right, it's cumulative to our ears. About 30% of that $2.5 trillion in America is because we're afraid of being sued. And so what are we going to do about this? Well, I think there's a few things that we can do. First of all, it's a 12-step program. We have to admit there's a problem, right? We're simply anti-creative. And, we also just need to teach creativity in medical school. Right now, we don't. We don't even get a class called the business of healthcare. And I think that's one of the most important things we can offer for medical students, how to make a living as a doctor. We need to partner med schools with design schools and art schools. And I think we just need to create this ecosystem of support, because right now, we have a very antagonistic ecosystem. I love that. And the other thing is, I think we should let the young teach the old. I've heard it said that the internet is the greatest generational divide since rock and roll, and I think that's very much true. There's a lot that the attendings can learn from medical students and residents about how to use computers, because 80% of all healthcare is currently run on handwritten notes. I think we need to have a sense of humor. Being a good doctor is more about being a good human than being a good God. And I think we need to reward innovation. There's a great company called Rock Health out in San Francisco that's a healthcare incubator startup, and they're investing in creativity. So times are changing, and it's a beautiful thing. We also need to gather the innovators, because doctors, just like everyone, adopts technology with a certain technology adoption curve. So this is something I started recently called Doctors of the Future. If you're a forward-thinking, creative doctor, just sign up. And, because I think these are the doctors that are going to change how we view and receive health care. We've gotten about 2,000 doctors in the past 4 months, so I think I'm excited about that. We also just need to be really honest about our fears. Is Dr. Cranquis really at risk? Well, no. There hasn't been a single patient dead from Googling health information. There's not a single reported case. So he's not really at risk. It's just we're afraid of that risk, even though it's totally non-existent. We need to change the base, more importantly. We need more art and theater majors, the best GPAs, MCATs, and brown nosers. They don't make the best doctors. You know, we need more doctors that think creatively in a different way. This is a gentleman who wrote his dissertation on a cardiac arrhythmia, and this is how he presented it. He looked at this in a whole new way and looked at the world in a whole new way, right? Because he thought beyond pills and scalpels to do something a little different. Because someday we're all going to be old, and we're going to need those creative doctors to help us get there. So thanks a lot.